Another effect, political effect, of the stigma and the stereotype of this disease affecting only white gay men was the belief that, white gay men have lots of disposable income. They have no children, they have beautiful apartments and nice cars and great jobs and vacation in Rio and all this stuff. And literally, the Presidential Commission on the HIV epidemic in the 80s said that, in effect, the gay community should take care of its own problem, its own disease, because we had the resources. And I laugh, not in a funny way, just in an ironic way, because, here in 1982, the Reagan administration's Health and Human Services Secretary declared AIDS to be the nation's #1 health concern and the greatest health threat of our time. Okay? Now, the Centers for Disease Control today estimates that perhaps 4% of American men over age 13 are gay or bisexual. 4% of the population of this country carrying the burden and the expense of addressing the largest health crisis of our time. Imagine that. The billions and billions and billions of dollars that have been spent on AIDS now over the years, that this community of people should carry the cost of addressing their epidemic. So, there was this us versus them kind of attitude that really prevailed around HIV, except significantly, very significantly, in San Francisco. And the reason it was different in San Francisco, and the reason San Francisco was able to create a model of community-based care and support for people with HIV is because there wasn't this attitude of us versus them. There was only us. Mayor Dianne Feinstein, who is now Senator Feinstein from San Francisco, she was mayor at the time, became mayor after Harvey Milk was assassinated, gay city supervisor in San Francisco in 1978. Dianne Feinstein had gay friends. She had gay advisors, some of whom I've interviewed. She had gay people in her administration, gay neighbors, other people in San Francisco, mixed and mingled. There wasn't this segregation between people based on sexual orientation. And as a result, people saw their neighbors and their friends, getting sick and dying. And so they came together and organized services, meal delivery services like Project Open Hand, founded by this retired widow, Ruth Brinker, to serve, starting with her next door neighbor, who was a gay man, sick with AIDS, and who wasn't able to prepare his own meals. And so she started cooking food for him. And then that spread, and soon, they were serving thousands of people and created a model for services across the country. But that's how it started in San Francisco, where this attitude of there's no us versus them, there's only us. And what an amazing difference it made in that city's response to the epidemic compared to most of the rest of the United States.